I kind of changed the focus a little bit in terms of getting a little of making this more of a conversation or a discussion rather than a training. And the reason for that is we have a lot of stuff that is really coming to play over this next couple of weeks. A lot of changes from the state and some changes that we're trying to make. And I think having a good idea of what's potentially coming down the road is going to give us some good line of sight for planning purposes, and getting some feedback from you is going to inform our work as well. So just looking at our agenda here, we're anticipating, as I said, a lot of changes. Some of those are opportunities that we're getting, with the movement to phase 3 based on our declining numbers in the state, and the improvement in terms of vaccinations, especially vaccinations in K through 12 staff. On the opposite side of all the good things happening are kind of the concerns with the different variants, and we'll provide you an update with that, and kind of the pandemic fatigue that we're all seeing around us and experiencing ourselves, and the challenges that's going to rise. We've got a couple of changes to talk about in terms of some discussions happening at CDC, some changes from Department of Health with phase 3, and some changes with our guidance from SRHD in terms of looking at improving our efficiency in terms of how we work and how you guys work in the districts. As I said, this is kind of an open discussion, so as we're going through this, if you have any questions, feel free to voice those as we're going through the slides rather than waiting till the end. And then if you have anything that's put in the chat, Victoria will bring those up and we can kind of talk about those as well. So just wanted to provide you a little bit of data on context. This is data that we presented to the school superintendents this week. And as you can see, our case numbers have been declining over time as an absolute number, as well as the cases that are infectious while in school. So this is kind of the success that we've all been responsible for, and a good reason why we're able to have some more flexibility where we are right now. I wanted to briefly talk about the variants. We've known we've had some of the variants in Washington State for some time, but I just wanted to break this out so that you can kind of see how this is spreading across the state. Most of what we're seeing, is the B117, which is the UK variant. And that's something that we anticipate as being the dominant strain in the United States over the next several weeks. In some parts of the country, it probably represents more than 50% of COVID. But we're seeing some of that activity here in Spokane. But I want to just mention one or two things about what you see in front of you. One piece is that even though our numbers in Eastern Washington look fairly good, like we're not seeing a lot of activity here, we are also not seeing as much testing activity as the west side of the state. So our numbers are certainly kind of influenced by how much sequencing is done. I mean, that is improving, but at this point, we can anticipate that we may have more activity than what we're seeing with our single case. I want to just kind of throw something out here. Lisa, did you have any other thoughts about the variants or other things that you wanted to communicate about what's happening? Lisa's been involved in a lot of the planning around the different variants, and just want to open it up for your perspective if you have anything to share.
Well, just to let everybody know that they've added at least a couple more variants of concern, and I guess there have been some reports of those also in Washington, but those have just been opened up from the CDC. And so we'll have a little bit more data regarding the other generalized variants, and there's a couple from California and a couple from New York. And so again, I still don't think that we're sequencing enough to have a fair representation of what's happening here in Spokane County, but just kind of making sure that you're aware. We're not doing anything special outside of just monitoring the cases and whatnot, and everybody's going to continue to follow those generalized guidance if they do test positive, regardless if it's a variant or not. But just kind of making sure that everybody is aware that these variants are present in Washington State, and that they, especially the B117 is around 50% of what we're seeing nationally, not just here in Spokane. So just kind of making sure everybody's a little bit more aware of what's sort of out there, so to say. But that's all I have, Mark. I do know that the CDC has opened up more variants that are closely related to the ones that are associated with the United States or the U.S. And I think there's 2 or 3 or 4 that are California and New York, and they all seem to be a little bit more transmissible than the generalized variants that we've seen in the past.
So, the big issues that we have on this is we're entering into phase 3, and this is going to start on the 22nd, and we're starting this more widespread activity, more options in our community, just at the same time that we're starting to see a lot more activity with these variants in Washington State and probably Eastern Washington. So that's part of our concern, always in the background in our minds. Any questions about that at all? Okay. So, and that's why I say kind of change is not really predictable. One of the things that we want to make sure that with all the things that we're talking about today, it's kind of the same situation we were in December and early January, where we were putting forth a plan for secondary education to open up at the same time that our rates were in the 800 or 900 range. We had a good anticipation of what would happen over the next couple of months. And we were comfortable putting a plan forward, even with those high rates, because we were very comfortable with pivoting and changing if we needed to. And I think that's the same perspective that we have with what we are going to be talking about here, is that we have an optimistic plan of what we want to see over these next couple of months, but that may change, and we're going to have to be flexible and be able to pivot back to a more safe course if we need to. So let's start talking about some of the things that are coming up in terms of planning. So I think many of you may have heard about this. This was a study that's gotten quite a bit of national attention, looking at kind of the 3 feet of physical distancing as opposed to 6 feet. It's a provocative study. There's some interesting pieces to it. There's also some concerns in terms of how generalizable that is. But at the same time, it is capturing a lot of attention. And CDC is, considering this as well as other information in terms of potentially providing some guidance in terms of moving to 3 feet of physical distancing, which would allow our schools to potentially go to full in-person, if this was to move forward. Now, this is not something that is likely to happen in Washington State unless CDC does decide to push forward a recommendation about moving forward to 3 feet of distancing. It does seem like this is a reasonable direction that I think many people think is a high probability for fall, but it's certainly kind of wide open as a question for this spring, and we're not likely to get a lot of notice on this. You remember with vaccinations with school staff. The day before that happened, with the federal government, we had no plans of accelerating teachers along the vaccine priority groups, and then the federal government moved, and then the state government pivoted, and things started moving a lot more quickly. So it could happen in the same way with physical distancing. But at this point, until CDC decides to move in that direction, I think we can anticipate staying the course, at least for the rest of this academic year. Are there any questions about the study or about some of the discussions that you guys have been having in districts or with district administration and leadership?
Mark, this is Carrie from Meade.
Yes.
We were talking this morning because, this is the hot topic as it gets more and more in the news, and teachers are already asking about it. And we're also being asked, because we're moving into phase 3, can our elementary kids start mixing at recess? What do you anticipate for those kind of like the cohort and non-cohort guidelines if this does become the case, or even as we move into phase 3? Our inclination is that we stay with the course. We're still trying to be as cohorted as we can in our elementary schools, and particularly at recess seems to be the hot topic right now that the weather's warming up. But, teachers and parents want the kids to be able to just play at recess and not stay in their classroom cohorts. What do you see going forward?
I mean, that's a good question of what we're going to see from DOH on that guidance. I hesitate on moving past what we've done with the cohort guidance at this point. That's provided a lot of protection in elementary schools. And I think that's why we see that as a little bit less risky overall compared to secondary. But this is something that we can kind of talk about. I mean, one of the issues that we're going to talk about in a little bit more detail are kind of mitigating measures, in the sense of if you do X, then that's going to allow you to do Y. And so this may be an issue where we can look at some other mitigating measures around recess. I'm hoping that we're going to see some changes, with the K through 12 guidance, as they start looking at some of that in anticipation of fall. But that's something that we can put up on our list of items to come to. Any other questions? Or even similar issues to what Carrie brought out? Because we're going to get into this in a little bit more detail a little bit later in the presentation. Okay. Well, I'm going to move to kind of Department of Health and some of the things that we're seeing there. And these are going to be a little bit more immediate. And we've had a chance to participate in the review of the draft guidance documents for some of the different subject areas that the governor is working on. You've seen the spectator guidance that's already been posted, and that's allowed us to move forward, with football and using our stadiums a little bit more effectively to make sure that fans aren't congregating outside or along the fence line in an unsafe fashion. I don't think that that's going to change dramatically from what you've seen on that. We do anticipate graduation guidance that's going to come out, we've been told, on the 22nd. And that is supposed to address both K through 12 as well as higher education. And I don't know if that's going to differ dramatically from what we've seen in the spectator guidance at this point. One of the planning assumptions that we were looking at for high school graduations is, could we use our stadiums and have parents and family in the spectator area in the bleachers, up to the capacity, which is 25% of that. And if we could do that and then have the students and the staff and the graduation ceremony, on the field itself. And that could be an option that would allow, provided that there's no rain, a kind of a similar graduation experience to what we've had pre-COVID, at least in terms of having immediate family there and those issues. So we haven't had a chance to really review that guidance, but we have had a chance to look at the phase 3 athletic guidance. And I just want to call out a few items that are going to be in there and then take some questions on that. What we've reviewed was the draft. And so when I say there's some items that are going to be talked about, I don't know that we can say exactly what that guidance is going to be, but we're going to, they're going to be addressing certain aspects of athletics for phase 3. And so one of the issues that they're going to address is with locker rooms, in terms of providing additional use of locker rooms, to include changing, to include potentially showers in certain circumstances. So that part of athletics is going to be addressed. They are going to be looking at addressing some of the issues that came up with cross country, about runners, running without facial coverings or masks. That was kind of something that was addressed with the FAQs after the initial guidance came out for phase 1 and 2. And so there is some discussion about having more generalized guidance, for outdoor sports, to allow, athletes to not wear a mask in competition. Some of the discussion has been around low risk sports such as tennis, cross country, some of those issues. Cross country is already an issue, but also golf, potentially with moderate risk sports such as, soccer, softball, baseball. So there could be some issues, that districts are going to have to make with decisions about mask usage, with those different sports. They're also calling attention specifically to wrestling, and I understand that that's it's a season 3 sport, but that's one of the sports, that's high risk, but that you can't really wear a mask, due to safety issues. So those are some of the issues that are going to be coming out. I just want to open it up for some questions, and then I'll make a comment or two about those. So any questions about those phase 3 areas of guidance that we anticipate seeing next week? Okay, no questions. What I do anticipate us seeing some guidance with regards to unmasked athletes, and I would encourage schools to consider holding a line on masking unless there are significant hindrances with the athletic activity. I think with cross country, you can certainly make a case for that. That's potentially going to cause problems, with running at such a high intensity. but I don't know that there's a competitive need or an advantage to be gained, let's say with golf or with tennis, where, there's a specific need or driver where those people in those activities don't need to wear a mask, where we're saying with other activities with kids in PE or recess that they do have to wear a mask and some of those things. So I know that we're going to have some of those opportunities with phase 3 guidance. I just am hesitant in utilizing those unless we have to, just because when you're looking at someone competing or practicing and not wearing a mask, and then they go to the bench and then they need to wear a mask, and back and forth of taking a mask off or putting a mask back on, we're going to get sloppy. We're going to have issues where it's treated a little bit more cavalierly, and I think we're just going to see some problems with that potentially. And we've been very lucky at this point of not seeing a lot of transmission with athletics. So I just want to throw that out as a challenge. Any other questions or comments on that, or pushback on in terms of those concerns? Okay. So the other topic that has come up has been DOH is in active discussions and work in terms of providing fall K through 12 guidance. And this is, in an effort to provide, some information to school districts as they look at contracts and as they look at budgeting for the fall. Depending on your crystal ball, I mean, you may see something where we're back to almost, more of a normal year. We will hopefully have children, potentially secondary, maybe younger children vaccinated. Testing might be more widely available, and we may see, back to normal distancing, or, you may see something that's, a little bit more gray in terms of if we are going to see vaccination available for elementary school kids at that point in time, or if we are going to see still a fair amount of COVID activity. So there's a lot of ambiguity there. DOH is understanding that, and they are really looking to provide some concrete guidance for districts to do planning around the fall. We have been participating in some of those conversations, but we don't have a timeline of when we're supposed to be seeing that guidance come out to the public. Any other questions on that? Okay. Okay, now I want to kind of talk a little bit about what's happening here at the Health District and why we're proposing to make some changes to our guidance documents at this point in time. So we had done this one other time, kind of in the late winter. We had removed the adjacent student rule, and just recently the sibling rule got removed. And a lot of that's being driven by rates as well as what's happening with our data. And we want to try to be as responsive as we can to really protecting the health and safety of students and staff in schools, but at the same time doing that with as low of a cost as possible. So we've been very fortunate, and I say, what the drivers have changed with, kind of excellence and accomplishment. And this is with the excellence of your COVID teams and the great work that they've been able to do. And the fact that we have accomplished a lot with those COVID teams in terms of very little transmission occurring within schools. And those two don't always go together. We can have excellent staff and doing a good job, but the virus can overwhelm us. And certainly that was the case in the fall, with what was happening in the community. But we're in the fortunate position, at least right now, where We have really good teams, and we've been able to do a lot of good work. So I want to talk about, some of the things that we are talking about internally. I don't want to go into a lot of detail in terms of we're going to do X, Y, and Z, because we're really not sure exactly what that's going to be right now. We're in discussions about this, but these are discussions that need to be informed by you who are in the trenches in the school districts, and we do want to get your feedback, and that's part of why we're talking about this in this meeting. And so one of the things that we have a fair amount of control over at the local level is how we quarantine and our guidance. If we look at the guidance that we put out with our cohort and non-cohort guidance, that was developed locally before there was guidance from DOH. Our sibling rule and our adjacent student rules were things that we developed locally and were able to do, while not necessarily requiring permission, from the governor's office or DOH. So we have a lot of flexibility in terms of how we look at quarantine. And so some of the issues that we want to look at are kind of the criteria that we have for moving between levels, of quarantine. So those are issues in terms of the number of cases or the percentages and number of classrooms affected. We want to look at that based on our data. We also want to look at how we're quarantining classes, and that may be looking at cases where they are could have picked up the infection in school, and cases where clearly, based on history, that this was acquired in the family or in the household, or with another event outside of school. So I think we want to kind of look at how can we really try to tease apart, issues of people being infectious while in school, and cases where there's a concern about transmission occurring, within school, because those are two different things. And if we can clearly identify someone who was just infectious in school, then potentially we may not count them as highly when we're figuring out, the question of moving between levels. So this may provide a little bit more flexibility in terms of moving to a level 2 or to quarantining a full classroom, where if we have multiple cases, in a classroom where it was clear transmission in their own home and no transmission really identified, in the classroom, we may have some more flexibility in terms of quarantining the classroom. We've had a discussion, with a number of school districts looking at busing and transportation and some of the issues there. We've been fairly aggressive with our quarantine on buses, and we are reevaluating kind of the metric we use, which is two rows up, one row back, and window to window. But we do realize that if we look at students in those areas, that some of those students are more than 6 feet away. And so we want to really reevaluate how we're quarantining on buses to be a little bit more efficient, and so that we're quarantining fewer kids. So that's one of the areas that we're looking at. And we're also looking at similar issues, with athletics, in terms of looking at measures where we would want to quarantine the whole team, or where we would have a little bit more flexibility. And as we kind of think about this, but I want to talk about our mitigation measures. And we have two mitigation measures that are, I think, are actually three, well, maybe four. We'll talk about four. That are modifiable and that are potentially, measures that we can use to offset quarantine. And what I mean by that is if we're looking at the guidance that we use for childcare, one example is that if we have a single case in childcare where students are unmasked, we do allow those students to continue to go to childcare, provided that they are tested on a routine basis during that quarantine period. So one of the issues that we want to look at is, can we use testing as an alternate option for immediate quarantine in certain situations? So for example, if we have an elementary classroom and we have two cases in that classroom where we would normally quarantine, and these two cases don't have any evidence of transmission and they don't have any close contacts identified in the classroom, we may look and say, well, if parents are willing to test their children, within a day or two of continuing to go to class, and then another time or several other times during the quarantine period, then we wouldn't have to quarantine if we didn't have any additional cases. So this may be and this is going to provide some optionality for schools if we move in this direction, where you have a choice. Do we quarantine this classroom, or do we provide a testing option to parents where they can continue to have their child attend school, if they go into a surveillance testing program? And we're in an advantageous position at this point because we are having a lot of testing pilots, within the county. We have antigen testing available to schools, even if they're not in a testing pilot, where this can be done fairly quickly, and that can provide an option for schools to use one of these mitigation measures to look at modifying quarantine. Could this also be done with athletics? If we have a case on a team, we've had some cases, where there was a concern. We've had a few with volleyball and a few with football, and I think one with soccer, where we had a single case and an option was moved to quarantine based on, not be able to really identify all people who would have been close contact and erring on the side of caution. Could we, in that situation, go with having those athletes go into that surveillance testing protocol, and if there's no new cases, they could continue to practice and potentially compete? So those are all questions that we are looking at in terms of looking at mitigation measures. Testing is certainly one of those. Vaccine is going to be another mitigation measure that may open up other options. We're now starting to see students who are getting vaccinated, maybe students who are working in retail settings, students who have chronic medical conditions. We're going to see more students who are being vaccinated. So it's not just a question with staff. We may look at mitigation measures where students are wearing a higher level of mask or facial covering, and could that be something that opens up kind of a choice, where if they're wearing a higher level of PPE, does that give us an option to put off quarantine if we don't have another case? Or kind of looking at ventilation issues, and does that give us other opportunities with that? So I've tossed out a lot of items. We've talked about this a little bit earlier in our testing work group, but I want to leave this out for some comment or questions. And if we don't have any questions, I wouldn't mind talking with maybe Meade or East Valley to talk about some of their experiences with testing as they've started their testing pilots. So any questions or comments?
Mark, there is a question in the chat box.
Oh, can you read that off?
Sure. Would this only apply to schools piloting testing sites on location?
So the testing pilots are set up by the state, but for other districts who want to get access to testing, we can facilitate that. We have a standing order with our health officer that can be applied to that, and schools can get a CLIA waiver with very little effort. East Valley, with their district, they did not participate in the testing pilot, but are now using Binax testing. I don't know if Steph or Lori, if you can talk about how easy or difficult it was to get started in that process. I'm not sure if either are on the call, so I just want to leave that out there. But it is something that we are more than willing to work with any district to get access to testing. And even if we're looking at private schools or smaller parochial schools, it's not something where you're required to have a school nurse. We're piloting antigen testing in business settings and other settings that don't have healthcare providers on staff. So that doesn't have to be an impediment with that. Any other questions or concerns? We're really interested in your feedback on this because if we do have the option of having a choice and with districts and with COVID teams to say, well, we have a situation that could result in quarantine. Maybe a school is in level 2 and a single case is going to go put those classrooms into quarantine. Maybe if we are in level 2 and we have another case, that those classrooms could go into a testing protocol, a surveillance testing protocol, and not have to quarantine those kids. This could be a way that even though we're in level 2, we're implementing surveillance systems that are going to be really helpful for us in terms of preventing disease. But we may not see as significant of an impact in terms of quarantine in that situation if we're willing to kind of engage in a testing surveillance testing protocol. And this would be, of course, voluntary. Parents do not need to do this. But if it was a question of engage in the testing protocol and participate in that, or parents would have to quarantine their children otherwise, it is an option where we could keep a lot of kids in school while we're responding to individual cases. So I'm kind of excited about this. I think it's a good option. It puts a little bit more control in your corner in the district. So any other comments or questions?
Mark, this is Steph. Sorry, I stepped away for a minute, but
okay.
Yeah, we've been using the Binax testing. It's worked out really well. People have been very appreciative. It's been a really simple process. We have the order from Dr. Velasquez. We have a procedure in place and a consent, and people in the district have been extremely appreciative. So it's an exciting opportunity to decrease absenteeism both among staff and students.
And I think from our conversations earlier, with both Meade and with East Valley, I mean, both schools have used this for symptomatic individuals. and testing kids if they're symptomatic in school, and testing them before they go home. And I think that there's some advantages to that. And again, I want to emphasize, this is not just for the big districts. This could be accessible by some of our parochial schools, some of our private schools. It does not require a healthcare provider, and it is a very easy process to get access to these test kits. There's no cost to them. That's the other piece I want to say. If you're getting test kits from us or through the state, those are no cost. So, any other comments from Mead or from East Valley on the testing?
Mark, I'm a smaller school, Spokane International Academy, and we've been using the curative program.
Yes.
Curative testing, and it's been really nice. You don't have to swab. You just swab the mouth of the student for about 20 seconds, which is super nice. You don't feel like you have to go up and swab the nose, and then you just send it off, and they take care of everything. They pay for the shipping to send it to a lab, and then results are coming back in about 2 days, which has been really nice to be able to help people out from having to go to different clinics and different things like that. So 600 kids in our school, and it's been working well. So.
And I just want to add a comment on that. You're with Spokane International, Spokane Public Schools that are using Curative. You can also get Binax test kits as well. I know we've had a recommendation, if you have people who are symptomatic, you could test with the Binax, and if that's negative, then do a curative, test, so that you could get an immediate result in some cases that could be actionable right away. But I think this is going to provide us a lot of utility. One of the things that I'm recommending with some conversations with the governor's office is to really provide some options for schools where, if they have vaccination or if they have testing, that could open up other opportunities. In the ideal world, we could say, for example, with wrestling, that's a high risk activity. It would be nice to have testing available for wrestlers. It would be nice to if the governor's office said, we really don't want a prom, but if you had all your juniors or seniors who were participating in that, if they were tested that morning, you could do a prom. We want to be able to provide some optionality to districts, if they have other mitigating measures, to be able to move forward with other activities. We'll see what the governor's office does with that, but I think we're going to see a little bit more flexibility with that in the fall. But I certainly want to see if we can build those processes in place with testing, right now. So. Any other questions? Otherwise, I'm going to move forward. I think we've got another slide or two, and I just want to make sure we have enough time.
Hey, Mark, this is Ruth at Mead, and I was just going to comment on the Binax. We had a success of having a student with symptoms being able to do the Binax, which we had a real rapid positive, and then be able to go and test family that had come to pick him up and get them tested right away, and let them know that they were positive also. So that was I think a positive in being able to help that family kind of acknowledge that they do have COVID, and start taking precautions from their different workplaces that they were at too.
Yeah, and having the speed of that, I think, is just really helpful, to have a result right away, to understand the implication with that classroom and with any siblings. Okay, any other questions or comments?
There's one more comment in the chat box, Mark, from Cindy, saying that having Binax testing available for her to use has been a game changer. So, another real positive comment.
Okay, Upper Columbia Academy. Thank you, Cindy. I mean, that's been a real blessing, with the boarding school, to be able to have that. Okay, well, I will move forward to our next slide then. Okay. Okay, Julie, you are up.
Great, thanks. We wanted to keep ventilation in the forefront. It's been stressed throughout the pandemic. And so as far as we are talking about planning and moving forward, now the weather is turning warmer, and we don't want it to be kind of out of sight, out of mind when people open windows, because when it comes fall and we get into wildfire smoke season, ventilation is going to continue to be real critical. So it's a good time right now, because my understanding is that we're getting to OSPI's grant cycle right now, and I know that some of those are going to only apply grants, or some of OSPI's grants are going to only apply for public school districts. But we're getting more information on that as well, to see if all of the grants really are just for public schools. I know that we've heard that some of the federal dollars coming out that COVID related, that's going to be money that's accessible also to private and parochial schools. So it's a really good time to be looking at the ventilation system. We know that a lot of folks have been doing upgrades the past several years, because we've been talking about ventilation in depth in relation to wildfire smoke. And some of the upgrades are the same. So the MERV 13 filters, for example, or extra HEPA filters. So again, just wanted to bring it in the forefront as the phase 3 guidance comes out and the fall guidance comes out from Department of Health. We anticipate that ventilation is still going to be right up there and being stressed. So while the monies are available, and while they will benefit you not only for COVID, but for other things like wildfire smoke, and of course, fewer complaints, better air quality, enhanced learning environments. Now's a really good time. If you don't know what filtration you have, if you're not sure if you've done upgrades, we're just asking you to go ahead and talk to your facilities and maintenance team. And if there are things that need to be addressed, just to really jump on it. So just wanted to pull that out there. And as we get more information, we can push it out there. So any questions on that? Okay, thank you.
Thanks, Julie. So I just want to kind of close things out. Just in the same way we were kind of trying to develop some processes and plans for where we thought the outbreak was going to be in February and March. We're now at the stage where vaccine is coming a lot more quickly. We're still at low rates. We feel like we can move forward in a number of areas, but we're comfortable that you guys are able to pivot back with us if we need to. And so we're really looking for any ideas that you guys have. It's been really useful for us to work with you on different plans. Veronica has been working with many of your districts around graduation, prom, and larger events. And 2 months ago, we would have thought that those would have been impossible. And I really want to challenge us to kind of think of asking about what is possible at this point, and looking at can we make some of these items that we associate with 2019 as potential possibilities for later on in the spring and certainly in the summer. So please kind of email us, contact us. We're really trying to participate in larger groups. We've had a lot of success talking with multiple districts at a time around graduation, athletics, and testing. That gives us a chance to share, best practices and to get a lot of feedback from a lot of districts at the same time. We want to continue along that same vein, of having these work groups. Graduation is still going to be moving forward in events. We're going to see continual meetings around athletics, I think, and testing. and certainly our work here in contact investigation has been really successful. So if there are other areas that we want to kind of work on, please email those to the education at SRHD inbox, and we can look at bringing those to one of the existing work groups, or if we need to kind of surface it with a newer work group. But I think, with the work groups that we have ongoing, that's going to cover a lot of the potential items that we have to look forward to. So we really need your feedback in terms of what we're trying to do with the guidance changes. We're going to be looking at conversations internally, at least over the next week or two. If we're going to see any guidance changes that are going to be significant, those are likely going to happen after spring break. We want to make sure that we're able to see all the phase 3 guidance that's going to be coming out from the governor's office, and that's probably going to take us to the middle of next week. And we have some DOH work groups that we want to make sure that we can dovetail with. So that's kind of our timeline of when we want to make some of those changes. So any last minute questions at this point, or comments from other people on the education team, Lisa, Veronica,
Mark,
Sandy, or Victoria?
we have one question in the chat. Christy's asking, is there any talk of possibly extending the 90-day immunity for fully vaccinated individuals? Did you want to mention that update?
Sure. So, Christy, that has been stealthily changed. This is a good thing to talk about. So, that 90-day language has been removed from CDC guidance, and our state health officer has been communicating at fairly high levels with CDC. And what they are saying now is that vaccine pass from quarantine is indefinite. So there's not a time frame on that, and this is provided that you are fully immunized with all shots in the series, and you're 2 weeks past the last dose, and that you're not having any symptoms. So the vaccines that your staff are getting now are going to be valid for consideration for quarantine over the summer, for programming, as well as the fall. And that may change over time. That may get modified. We may see booster shots. But for right now, it is not a 90-day pass for full immunizations. It is seen as indefinite.
So, Mark, that 90 days still applies to people that have had confirmed COVID infection, correct?
Correct. If you have a past infection, that's only a 90-day pass from quarantine with that. That is correct. We've heard kind of murmurings that they were going to move that to 180 days. We have not seen any indication that that's coming anytime soon. So at least for the short term, we're 90 days with a recovered infection, and we're indefinite with a full vaccination series. Good question, Christy. I meant to talk about that earlier. So any other questions? How about, if there's no other questions, any feedback from other people on the education team on kind of clarifying things that I may have went over a little bit too quickly or in a vague fashion?
Mark, we're getting quite a few questions about folks returning from travel. Maybe we wanted to speak to what guidance we're currently listening to about when folks can come back, who needs to quarantine, what the testing recommendations are there.
With spring break, yeah, that's coming up. So right now, the governor has not modified his travel recommendations, in terms of quarantine for return from travel outside the state. I'm not aware that those have been modified. We think that is going to get modified at some point, because right now, even with someone who's fully vaccinated, they're still required to quarantine, with the governor's guidance. So we're hoping to see some changes on that for fully immunized folks. But right now, the recommendation, and it is a recommendation, not a strict requirement as far as my understanding of that, to still quarantine on return of travel. but that is a hot topic with the state. And if we get any updates on that, we will certainly update everyone.
Mark, I thought I saw that there was an update on the governor's website about air travel specifically, saying that they were going to stick to CDC recommendations related to air travel.
Okay.
And that air travel requires testing, doesn't it, on return? Even for vaccinated?
There's two options. So if you get tested, you get to leave quarantine 3 days earlier than if you don't get tested. So they're recommending that when you return from air travel, you get tested 3 to 5 days later, and you're self-quarantining for a full 7 days. But if you don't get tested, that you stay home and quarantine for those full 10 days.
Is it a recommendation with the CDC guidance or a requirement?
It sounds like a recommendation.
Okay.
But if you're looking at the governor's website, he states that he amended the proclamation to require all air passengers to comply with the requirements ordered by the CDC.
Okay.
So from our end, it looks like a requirement.
Right, because of the governor.
Yep.
Thank you for that clarification. Any other comments? Okay, I will stop presenting. And I think we will give you back 3 minutes of your time unless